Good afternoon, everybody, and welcome. My name's Petrina Ficaro, and I'm the CEO of Cystic Fibrosis Queensland. Today is our first in a series of interviews with some of our experts from around the world. We're really excited this afternoon because we're kicking off with Professor John Moore. Professor Moore is a clinical microbiologist in the Department of Bacteriology at Belfast City Hospital. John's actually our keynote speaker tonight at our parents event that we're holding over at the West Rugby Union Club. But of course, many of you are unable to attend tonight, so we really wanted to take this time to spend with John so that he can talk to you about the research that he's working on, some of the project that he's doing. So John, over to you. John's going to take us through a bit of a walk through his world. Thanks, John.
Thank you very much, and thanks to everyone for tuning in this afternoon. It's a great pleasure being here in Queensland, sunny Queensland, because actually your winters are a lot better than our summers up in the northern hemisphere. So it's a great privilege to come here and also to experience some of your nice weather. So yes, I'm a clinical microbiologist. I've been a clinical microbiologist in the Belfast CF Centre, and that's both the adults and the children. And what I want to do today and this afternoon and this evening is to give you an insight into my world as a microbiologist, because it may be in a world that you're not particularly familiar with. You're very familiar with some of the other specialties within the multidisciplinary team, such as your CF doctor, your CF pediatrician, also possibly your CF nurse, your CF dietitian, your CF social worker, and possibly your CF pharmacist. But probably you've never been let loose with the CF microbiologist. They're kind of hidden in the back room and never let out. So they've actually let me out from the UK, and I've landed in Australia. So it's an opportunity for folks to come along and to ask all sorts of questions that they've never wanted to ask or are too frightened to ask. But now this is your opportunity to ask a CF microbiologist. So what is CF microbiology, and why is it so important? Well, with CF microbiology, it's very important to the whole disease state. There's really about 5 pillars what CF microbiology does to help manage and diagnose your disease and the bugs in your disease. So what is microbiology? So microbiology is really the study of microorganisms associated with 4 different classes. The first one is viruses, and we're all familiar with viruses, and that's called virology, and that's the study of viruses. So things like the coughs, the viral coughs, flus, whooping cough, those type of infections. Sorry, the whooping cough is a bacteria, but with the other sorts of infections with viruses, such as other respiratory viruses, such as adenoviruses or viruses like RSL. So the issue then is we've got bacteria, and we're probably most familiar with the bacteria, and that is the likes of the Pseudomonas and the Burkholderia, the Haemophilus, the Staph aureus, probably names of bacteria that you're very familiar with, that your doctor or your pediatrician has mentioned to you. Then we've got the study of viruses, which I said were virology, and then mycology, which is the study of fungi. And you may have heard of certain fungi called Aspergillus or Scedosporium or Oxyphyalla and viruses, or fungi like that there. And then we've got the study of parasitology, and we're not really that interested in parasites with cystic fibrosis. The real biggies are bacteria and fungi, and also the viruses. So we also use bacteriology and CF microbiology to help stage your disease, to know whether or not you've got a certain infection or not. We use all sorts of potions and lotions and techniques with DNA, very, very much an evolving technology, bringing in better ways of detecting infections in your lung. And also then we use cystic fibrosis microbiology to help guide your doctor to know whether or not what is the best antibiotic to use, or combinations of antibiotics, whether you need an oral antibiotic, whether you need a nebulized antibiotic for chronic Pseudomonas infection, or whether you need an IV antibiotic where you've maybe got a pulmonary exacerbation and need to come into hospital for some IVs. Also, microbiology is used to help decide on infection control and prevention strategies to make sure we keep people as infection free as possible, so they're not sharing bacteria amongst others. And sometimes that can seem a very draconian way to do things, but it's important that we actually keep the barriers up and keep those bugs from jumping from patient to patient or from the environment to patient, and keep you healthy and infection free for as long as possible. Probably the last pillar of microbiology then is to help look to see whether people are eligible for certain procedures, medical procedures like lung transplantation, because if you've got certain bugs, then the lung transplantation limits or the options become very limited to you, because we know from previous work that if you've got certain bugs, people with certain bugs don't do particularly well if they get a lung transplant. So we have to be very, very judicious in being able to detect these bugs and to help with the transplant physicians to know if a patient's eligible based on their microbiology, and then that we're there for the journey after the transplant, that we keep the folks as healthy as possible and keep them away from certain bugs which would cause them damage. So that's really what safe microbiology is about: virology, bacteriology, mycology, and parasitology. And we're going to have a bit of an exploration of that with pictures, and images later on. So please feel free to come along, and I look forward to seeing you. Thank you.
Thanks, John. As we mentioned, we're going to be loading the full presentation onto our website for you to view. So do come along tonight, and if you can't, please do jump on the web and have a look tomorrow. Thank you very much, everybody. Bye.